Today's part 4 of the SI joint pain and hip pain series that I've been doing of exercises that I most commonly use here in the office. Today we're going to go over the 11-month tripod, which adds a little bit more resistance against gravity and adds a rotational component. So I'm going to show it to you in 2 different positions, one from behind and then one from the side. So let's get into it. So we're going to start out in the kneeling position. Typically I will start people facing an object like a couch or an ottoman or a chair at home, and then here in the office I'll use the table so that they have a counterbalance when we go to put some resistance against that hip, because if you've got a hip that isn't stabilizing, it's going to make it tough, and we want to make sure that you're able to get the right muscles activated. So we're going to start out by facing it. The top leg is going to be in a 45-degree angle. Bottom leg of the down leg is going to be down with the knee directly below the hip. Hip is going to be directly below the shoulders. And the knee is going to line up directly behind the heel. The down leg, we're going to turn at a 45-degree angle, and we're going to be upright. You're going to utilize that diaphragm breathing that we've been working on and getting control of to breathe down through the seat of the pants. Using that abdominal brace, we're going to make everything nice and solid. Make sure that you're at least touching the counterbalance to begin with, but you're going to rotate the pelvis, and when you rotate the pelvis, you don't want this up leg to go in and out. You want to basically close it like a book at the hip. Then from there, keeping the trunk nice and straight, you're going to hinge from the hips out to the side, following the thigh of the up leg, that direction. And when you're doing it correctly, you should feel it on the medial quad and the outside hip, because that's going to stabilize the inner thigh and the outer hip, helping that hip stabilize when you're standing up, when you're doing activities, things like that. You hold it for 10 seconds, squeeze the glute coming up, give it a 2 to 3 second pause, and then head back down. Typically, I'll have people do that about 3 to 4 times a day, doing 10-second holds for each rep. I'm going to show it to you from the side now, that way you get a different view of it.